Unit VCS06 Learning Outcome 2. Be able to provide specific nursing care to animals. Assessment criteria 2A to 2F. Aims and objectives to cover the following. ID a range of common medical and surgical care requirements to include routine surgical such as neutering and medical conditions such as those requiring regular monitoring. Intravenous fluid therapy cases. Assist with the preparation of a cat and separately a dog for anaesthesia in accordance with veterinary instructions. Assist with the monitoring of anaesthesia of a patient in accordance with veterinary instructions and under direct supervision of a veterinary surgeon. Select suitable accommodation to reflect the recovery needs of the species and procedure experienced. Demonstrate the recovery position on an animal. Assist in monitoring animal recovery. Provide information to the veterinary surgeon on any problems or unexpected events. And record and maintain monitoring information during the recovery procedure. Assessment criteria 2A. Identify using a mind map common medical and surgical cases and their care requirements to include routine surgical such as neutering, medical conditions, so those requiring regular monitoring, and also IVFT cases. I would like for you to consider experiences and knowledge from your own workplace to assist you, as well as textbooks and online resources. Please then upload this onto OneFile for your veterinary educationist to mark. Assist with the preparation of an animal. This is an area that you will complete practically within the workplace with the support and direction of your qualified team and your mentor. You will prepare separately a cat and a dog. You will assist with the admission procedure following instruction and direction. You will also assist with pre-anaesthetic checks to include a full health check and checking of the TPR baseline parameters. You may also assist to obtain pre-anaesthetic blood tests to enable the checking of the functioning of the kidneys and liver prior to any procedure taking place. Please note that the pre-medication types will vary, and this will depend on the individual, their species, their health status, and also the procedure that they will be undergoing. You will be involved in stress management, keeping the animal calm, treating the patient and keeping them at ease. Gentle handling and talking and home comforts will also assist. You will also manage the environment, consideration of the siting of the patient in an appropriate ward. You will need to consider the predator-prey specifics, but also your practice is set up so as to whether you have designated species wards, or if you haven't, what you can do to overcome such predator-prey issues. You will also accurately complete any records and documents if asked to complete such paperwork. You must ensure that you do so accurately and make sure that you update it with the date, time and also your initials so it is very clear who has been carrying out such recording of documents. Practical monitoring of anaesthesia of a patient. You will assist with the monitoring of animals, and this will include the cranial nerve reflexes, including signs and explanations of each, the heart and pulse rate, rhythm and quality, including the normal expected ranges of each, the capillary refill time, mucous membrane colour, and the normal ranges of each, respiratory rate, rhythm and depth, including normal ranges of each again, and also body temperature, including normal ranges. All of the above must be carried out under the direct supervision of a veterinary surgeon. We have already theoretically covered the normal range of TPR, mucous membrane, colour and capillary refill time. Please complete the following tasks to ensure that you are aware of the use of the cranial nerve reflexes. There is an accompanying handout for you to do so. Suitable recovery accommodation. It is vitally important that you can select suitable accommodation, and when doing so, you must consider the following. Species. Consider the predator-prey dynamics, the procedure performed and how this may influence accommodation, appropriate bedding and reasons for use. And you must consider absorbency and comfort, and also the individual needs of the animal and a consideration of the surgery that they may have undergone. The temperature of the accommodation, and again this will link back to the species. their age as well, and this is vitally important to help to keep the animal warm, the appropriate furniture and fixtures that the accommodation will need, and the appropriate size and location. So in some situations, for example an animal recovering from an orthopaedic procedure, you may need to restrict movement upon the veterinary surgeon's instructions. Location, again this will link back to species and also the dynamics of your practice as to whether you can separate into different wards. And the environment, considering what is appropriate for a recovering animal. Ideally, we, in an ideal world, would have some solely recovery areas in our practice. However, this isn't always the case. So what can we do to make the environment as calm, as quiet and as comfortable as possible for that animal? Using your textbooks and also your own practice procedures, I would like you to complete the following tasks. Produce an explanation of the above and provide examples within the table on the accompanying handnote. Recovery position. Many routine procedures require that the patient is to be positioned in a lateral position for recovery, and the side of which will depend on the type of procedure that has taken place. We would not place the animal onto the side in which the surgery has taken place, we would place them on the opposite side. However, in some situations, sternal recovery positions may be required, and this is generally to aid those who may have difficulties with normal respiration. And that is going to help to assist to return respiration to as normal as we possibly can. We can use aids such as towels, sandbags, etc. to assist us to do so. Also remember the species and the procedure considerations, and the veterinary surgeon will advise you. Monitoring recovery. It is vital that when doing so you liaise with the veterinary surgeon. This is really important to enable you to confirm the procedure performed, check the requirement of recovery and monitoring vital signs, and this can include specific factors associated to the procedure itself and also the species and the individual. This will then allow you to report back to the veterinary surgeon on the quality of their recovery, whether the recovery was as expected or different from what was expected, the animal's pain response, and also the animal's demeanour generally throughout the recovery period. Provide and record information. You will be involved in recording information on the patient's records, and this can include consent forms, hospitalisation sheets, anaesthetic monitoring charts, and you must record all observations on the recovery chart as per practice protocol. This will generally include the recording of your initials, what took place, the time and the date. It is essential that then you inform the veterinary surgeon of all your observations, any problems or any unexpected events. In summary, you've been provided with a verbal overview and related tasks to prepare you to practically undertake the aspects stated in the slide below. When covering these tasks from a practical point of view, you must be doing so with the guidance and direction and supervision of the qualified veterinary team to ensure that you're acting accordingly at all times, following instructions that are provided and actually clearly relaying any findings, so that the whole team is kept up to date, up to speed, and is aware of what is going on with an animal throughout all of these stages.